Donning and doffing PPE. If at any time you feel that you have made an error, please use hand hygiene between any of the steps or wash any area that has been mistakenly exposed. When donning PPE, begin by checking which PPE is required by reviewing the signage outside the room. To reduce risk of transmission, ensure hair is pulled back and jewelry is removed or minimized. For enhanced airborne droplet contact precautions, start by performing hand hygiene for 15 to 20 seconds. Rub palms, wrists, in between fingers and thumbs, back of hands, and along the nail beds. Alcohol-based sanitizer is the preferred method. Use soap and water when hands are visibly soiled. Don your gown by first closing the back of the neck. Tie the waist, ensuring all clothing is covered. Place your fit-tested N95 mask over your nose and under your chin. Place the top strap at the crown of your head. Stretch the bottom strap over your head to the back of your neck. Mold the nose strip to ensure a secure fit and tight seal. Without touching the mask, perform a seal check by placing your hands at the top and bottom while taking deep breaths to feel if any air escapes. If air is felt, readjust mask for proper seal. Don face shield by placing strap at the back of the head, ensuring the shield is resting in the middle of your forehead. Put on gloves one at a time, making sure they are snug over your gown and no skin is exposed. When entering a negative pressure room, ensure each door is securely closed behind you. When doffing your PPE, step into the anteroom, ensuring the door is closed behind you. Remove the first glove by pulling it up and away from the middle of your palm, ensuring no skin contact. Hold glove in the other hand. To remove the second glove, place a finger inside the clean area of the glove and push it off, balling up both gloves together. Throw into the garbage. Remove your gown by first opening at the neck and then at the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll into a ball and then throw into the garbage. Perform hand hygiene for 15 to 20 seconds. Remove the face shield by leaning forward, pulling the strap forward and away from you. Place into the garbage. Remove N95 mask without touching the exterior part of the mask. Again, pull it forward and away from you by starting with the bottom strap and then the top. Place it into the garbage. Perform hand hygiene again. For droplet contact precautions, a procedure mask is required. Follow the same donning procedure for the hand hygiene, gowning, and glove placement. For the procedure mask, place elastics around ears, form to the bridge of the nose, and pull under the chin. Follow the same doffing procedures by removing gloves one at a time using the glove-to-glove, skin-to-skin technique. Remove your gown by opening at the neck and then the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll into a ball and then place into garbage. Perform hand hygiene. When doffing a procedure mask, carefully remove straps from ears and pull forward and away from your face and body. Perform hand hygiene again.